Hi, I'm Faysal Yafi from the University of California, Irvine.
And I'm Peter Tsambarlis from Rush University in Chicago.
Pete, welcome to San Diego. We're going to be talking today about the PRP paper that was recently published in the Journal of Urology with Tom Masterson and the group from the University of Miami. So what are your thoughts?
Yeah, I think it's part of the bigger picture of regenerative therapies, which are really hot right now. I know you've had some experience with a lot of those, and I was wondering what you were thinking about it before we could get into the details of this paper.
Yeah, so regenerative therapies is one of the hottest topics in urology and in sexual medicine for sure. We have to break it down into stem cells, PRP, and shockwave therapy. And I think when we're talking about shockwave therapy, it has the most amount of body of evidence, and there's some more and more data supporting its use, and the European guidelines actually have it in their algorithm. Stem cells potentially has the least amount of evidence, and PRP is a new and up and coming modality that we're investigating. What are your thoughts about the paper and about the outcomes and maybe perhaps the limitations of that paper?
Yeah, so I liked the study design. I felt they were really scientifically sound. They did a randomized, placebo-controlled, double-blinded trial, which they took some really significant measures to limit bias that they described really well. I think as far as the outcomes go, they were pretty direct. This looks to be safe, but based on this single study, not necessarily effective, and I think it was a call for more research, and that's a little bit counter to the previous data from PRP, which I think stimulated this more rigorous study.
So what do you think currently are the limitations from us adopting PRP as an intervention in sexual medicine?
Yeah, so in terms of the logistics, I don't think we know the differences between the machines to actually isolate the platelet-rich plasma. In terms of limitations of the studies, I think we have to realize all of these studies, even the encouraging ones, were single center, relatively limited sample sizes, and short follow-ups. So we don't have much long-term data even on the better studies. This study in particular didn't necessarily show efficacy.
Yeah, and I agree, and I think we need more data. We need larger group populations. We need more homogeneous populations of patients, a standardized regimen that everybody can adopt before we can start saying that PRP is ready for prime time. And what are your thoughts about PRP as a standalone treatment versus potentially as part of a larger multimodality treatment?
Yeah, it's going to take a long time to prove which multimodality treatment might actually be efficacious. I think it's much more likely to have a role as part of a multimodality therapy than as monotherapy. Interestingly, that's kind of the opposite of what the paper showed, where by allowing these patients to continue with PDE5 inhibitor use, they actually ended up with worse results than the studies where they stopped them. So I don't actually have a good explanation for that.
So I think, again, like a lot of other modalities in sexual medicine, sometimes the commercialization of these products is ahead of the science, and I think we need more science. But, exciting avenue, and I think we're excited to see in the next few SMSNA meetings and AUA meetings what new data comes out from PRP.
I agree.
For more content like this, look up our SMSNA page on YouTube.